This is, our next and newest and brightest flagship hospital. We'll have 3 wards that are just dedicated to women's inpatient care, in addition to several ORs that are going to be doing just GYN-related surgery. And when you think about research, service, and training, the 3 things that we link very heavily, we are using this as an opportunity to, from day one, kind of have those intertwined. We're building this hospital to accommodate teaching rounds. None of our other hospitals can really do that. We're building the 2nd floor of our hospital to have seminar rooms with high-speed internet for our students here, Haitian medical students and nurses, to be able to upload a video and watch a video from a lecture at Harvard Medical School right here in rural Haiti. As Partners in Health expanded in the Central Plateau, La Colline, Boucancare, Cange was already there, Belladère, the people, the denizens of Mirebalais, felt that in order to get quality care, they had to go outside of their own city. So in November of 2008, we officially were asked by the Ministry of Health to fill the void, and we responded in kind. We're going to have, modern sterilization facilities for our 6 operating rooms, 6 being the most operating rooms in a public facility in the country. We're going to have digital radiography, again, not available in the public sector, but doing it in a way that is responsible insofar as making sure we can maintain what we're doing. We have to walk a fine line because we can't put systems in place that are incredibly novel in terms of a technology point of view that in 3 months then break down and we can't service them. I can't think of a better way to serve the poor than to create a modern, state-of-the-art medical facility where you're not going to have to leave the island of Hispaniola to receive cardiothoracic surgery. You're not going to have to leave the island to receive complex orthopedic surgery. You're not going to have to pay, become further indebted to get an echocardiogram. All these things are going to be available right here in central Haiti for the people.